Welcome to Recognition and Management of Neonatal Sepsis, Red Flags, Protocols and Clinical Confidence. This CPD course is designed to help healthcare professionals like you identify early signs of neonatal sepsis, apply treatment protocols confidently, and improve outcomes through structured clinical training. Let's begin. Who should take this course? This course is designed for frontline professionals involved in neonatal care. Registered nurses, midwives, NICU and paediatric healthcare staff, clinical educators, and rural health workers. Whether you're in a high-resource hospital or a remote setting, the principles in this course apply across care environments. Why this course matters. Neonatal sepsis is one of the top causes of newborn death worldwide. What makes it especially dangerous is that its symptoms are often subtle, easy to miss in a busy clinical setting. Early detection and timely intervention are critical. This course equips you to recognize red flags, start treatment promptly, and confidently follow clinical protocols that save lives. Course Overview and Learning Hours. This course includes 6 core modules and provides 2.5 CPD hours. That's 150 minutes of accredited learning. Here's what we'll cover. Understanding sepsis, differentiating early onset and late onset types. Enzrenia flags and risk factors. Diagnostics and interpretation. Management and antibiotic protocols. Escalation pathways, antibiotic stewardship. By the end of this course, you'll have a practical, well-rounded approach to managing neonatal sepsis in real-world settings. Module 1. Understanding neonatal sepsis. Neonatal sepsis is a life-threatening bloodstream infection in newborns. It comes in 2 forms. Early-onset sepsis, EOS, appears within the first 72 hours of life, often passed from mother to baby during birth. Late-onset sepsis, ELOS, appears after 72 hours, typically caused by environmental or hospital-acquired infections. Common bacterial sources include Group B Streptococcus, E. coli, and other pathogens. Premature or low birth weight infants have underdeveloped immune systems, making them more vulnerable. EOS versus LOAS comparison. Let's compare the 2 types. EOS is often linked to maternal infections, such as GBS colonization or prolonged rupture of membranes. LOS, on the other hand, typically develops after 72 hours and is more commonly hospital-acquired or related to poor infection control in the environment. Recognizing which type you're dealing with affects your choice of antibiotics and clinical response. Module 2. Red Flags and Risk Factors. The next module focuses on subtle symptoms and high-risk scenarios. Sepsis doesn't always announce itself clearly. You'll learn to spot warning signs such as poor feeding, unstable temperature, or brief episodes of apnea. Understanding when to monitor more closely or escalate care is key, especially when risk factors are present. Red flag symptoms. Red flag symptoms include temperature instability, either too high or too low, lethargy or weak muscle tone, breathing changes, especially apnea, poor feeding or refusal to eat, cyanosis or bluish skin, and general irritability. These symptoms, even when mild, should raise concern. High-risk birth factors. Be especially cautious in the following birth scenarios. Prolonged rupture of membranes greater than 18 hours. Maternal fever during labor. Known Group B strep colonization. Invasive procedures at birth, such as forceps or internal monitoring. These increase the baby's risk of developing sepsis and should prompt closer monitoring. Module 3. Diagnostic testing and interpretation. Accurate diagnosis starts with the right tests. We'll cover how to interpret C-reactive protein, CRP, procalcitonin, and complete blood counts, CBCs. You'll also learn how to properly collect and understand blood cultures. In some cases, you may need to consider a lumbar puncture or other advanced diagnostics. Key diagnostic tools: CRP and procalcitonin. These are inflammatory markers that rise in response to infection. CBC look at WBC count, neutrophil ratios, and platelet levels. Blood cultures. These identify the actual bacteria causing infection, crucial for selecting the right antibiotic. Always consider trends over time, not just one value. As Module 4, Management and Antibiotic Protocols. Management begins the moment sepsis is suspected. First, ensure continuous monitoring and support breathing. Then, initiate empiric antibiotic therapy based on whether it's EOS or LOS. Timeliness matters. Antibiotics should begin within 60 minutes of suspicion. First response actions. Your first steps should be: begin close monitoring and vital sign checks, provide oxygen or respiratory support if needed, draw blood samples and start empiric antibiotics, notify the medical team. This is sometimes called the golden hour, when quick action can prevent deterioration. Empiric antibiotic choices. For EOS, the standard empiric treatment is ampicillin plus gentamicin. For LOS, your team may use vancomycin and cefotaxime, depending on hospital protocol. Always adjust your choice based on blood culture results once available. Module 5, Escalation Pathways and Sepsis Bundles. Now we'll walk through structured clinical pathways. You'll learn to follow your hospital's sepsis escalation process. We'll also explore the sepsis bundle, a standardized checklist used to ensure critical actions are completed on time. What is a sepsis bundle? A neonatal sepsis bundle includes initial assessment and risk identification, prompt collection of blood work and cultures, administration of antibiotics within 60 minutes, regular monitoring and complete documentation. It helps teams stay on track under pressure and ensures no step is missed. Module 6, Antibiotic Stewardship. Overusing antibiotics can be just as dangerous as underusing them. This module teaches you how to de-escalate therapy based on clinical improvement and lab results. You'll also explore the global impact of antimicrobial resistance and how neonatal care plays a role. Course summary and next steps. By now, you should be able to recognize early signs of neonatal sepsis, order and interpret diagnostic tests confidently, start antibiotics within the golden hour, follow structured escalation pathways, practice safe and responsible antibiotic use. Now, take the final quiz to assess your learning and download your CPD certificate for 2.5 learning hours in neonatal sepsis management. Thank you for being part of this important journey.